Good morning, everyone. I'm Mark Fucello from the ACF Office of Planning, Research, and Evaluation, and my division is responsible for this conference. I'm marking a sort of anniversary since I had a hand in developing the agenda for the first one of these conferences 20 years ago under the direction of Howard Ralston. Through a remarkable turn of fortune's wheel, I returned to OPRE over 14 years ago, where I have the honor of working under the direction of Naomi Goldstein. We called the first one of these gatherings the Welfare Reform Evaluation Conference, for reasons that were obvious in 1998, and then shortly afterward, the Welfare Research Evaluation Conference, now the Research and Evaluation Conference on Self-Sufficiency, which is better than the other names because it more accurately reflects the breadth of the conference's content. Although we quickly dropped the reference to reform from the conference title, perhaps reform is a seasonal state that human services and employment systems encounter. The complexities faced by public systems and program administrators aiming to make good decisions, and we hope trying to translate and apply the knowledge that research produces, is often a daunting task. Program improvements require change. Working to make any improvement and advancement toward our mission to help vulnerable families fully participate in the economy and thrive by all the health measures that matter requires credible knowledge. It's imperative that we rely on knowledge produced through the most rigorous approaches appropriate for the question at hand. That's an introduction to this morning's plenary, implementing the recommendations of the Commission on Evidence-Based Policymaking. But before I introduce Nick Hart, who will moderate this morning's plenary, a few announcements. This conference was designed and produced by a team led by Tiffany McCormick and Amelia Popham, who were diligently assisted by Victoria Kabak, Gabrielle Newell, Catherine McKinney, Elaine Carpenter, Derek Joyner, and Deanna Cheatham. And of course, thanks to our contractor team at Impact, who have supported us for many years. Now I get a chance to use one of my favorite baseball quotations by the great Yankee and Mets manager Casey Stengel, who said, "Managing is getting paid for home runs someone else hits." Luckily for me, my entire team is made up of sluggers. We hope you had an opportunity to join the social gathering yesterday. It was a lot of fun to reconnect with old friends and meet some new faces. We're looking forward to another exciting and productive day. A few things to note. Today we'll be holding a lunch symposium featuring Scott Allard, who will talk about his latest research on the geography of poverty. This afternoon we have facilitated roundtables which offer you a chance to have interactive discussions with presenters and researchers. A few presentations, roundtables you might want to explore are exploring the TRIM microsimulation model to estimate effects of social welfare programs on family income and poverty, discussing how a conceptual framework for self-regulation and goal setting in employment programs can be applied to other aspects of family well-being, examining how behavioral design and user experience approaches can be integrated into human services programs. I would also like to highlight a roundtable titled Building Knowledge on Employment Programs for Low-Income Families, Where Do We Go From Here?, which will discuss a new project presenting opportunities to participate in an OPRE evaluation. All the roundtable locations are listed in the conference agenda. Following today's sessions, there will be a young professionals happy hour at the Marriott Marquis Hotel down the street. Details are listed in the networking section and in the mobile app in the program book, although I'm told you won't be turned away if you have a touch of gray. Just a reminder to download the conference app that allows you to view the conference agenda, plan your schedule, connect with other attendees, and share your thoughts via Twitter directly from the app, and generally improve your life in many ways. There are signs about with download instructions as well as one pager at the registration desk with quick tips for using the app. I would like to remind those who are viewing this and upcoming sessions via RECS Live the conference live stream, that you can send questions to session panelists via email at 2018recs@gmail.com, 2018recs@gmail, by tweeting with the hashtag RECSLive, or directly on the live stream using the Submit a Question function. So now I'd like to welcome this morning's plenary panel. If you would like to come up. I don't know if oh, there's Nick, Katharine. So I'm going to introduce Nick Hart, who will moderate this morning's plenary. Nick is the director of the Bipartisan Policy Center's Evidence-Based Policymaking initiative. Prior to joining BPC, he worked in the federal government, most recently as the Policy and Research Director for the U.S. Commission on Evidence-Based Policymaking. In that capacity, he oversaw the Commission's policy and research team and led the drafting for the Promise of Evidence-Based Policymaking, the Commission's final report that was presented to Congress and the President in September 2017. Nick has worked at the Office of Management and Budget as a senior analyst. He chairs the American Evaluation Association's Evaluation Policy Task Force, and he holds a doctorate from the George Washington University, specializing in program evaluation. Hand it over to you, Nick.
All right, thank you, Mark. Turn this on. Thank you, Mark. And can everyone hear me okay? There we go. Thank you all for joining this conference. I think this is, I was just describing to Naomi earlier that this is one of my favorite conferences that comes back to DC every couple of years, and I think this is a really good opportunity for you all to learn about the recommendations of the Commission on Evidence-Based Policymaking, which hopefully will be directly applicable to some of the work that you're all doing. So I think this is a really exciting time for the conversations that we're having in DC and policy around how to improve the generation of research and evaluation and statistical activities across government. There's been a lot of great work that has happened, and many of you have been part of that over the last 20, 30, 40, 50 years. And I think you all know that there are a lot of challenges to doing your work. And that's a problem for some of the things that we want in government. We want good information to be available to inform government policies, and if we can't have the processes and the procedures in place to actually enable you all to do the good work that you need to do, then that's a real limiting factor for achieving a broader goal. So there's an interesting combination of folks on Capitol Hill that acknowledged this a number of years ago. Speaker of the House Paul Ryan and Senator Patty Murray. Of course, Speaker of the House Paul Ryan was not Speaker at the time. He was the budget chair in the House, and Patty Murray was the budget chair in the Senate. And they were going through a really heated budget negotiation between Democrats and Republicans, and basically acknowledged that a lot of the information that they wanted to be able to use to guide the decisions that they were making around anti-poverty programs, the entire suite of activities in government, a lot of the information simply wasn't available. Either the studies hadn't been produced, or they weren't available in a format that was useful for members of Congress. And so they agreed together, as a Republican and a Democrat, to figure out a way to do better. And they developed a strategy to develop a commission to make a set of recommendations to do better. So beginning in 2014, they started working on this piece of legislation to create the Commission on Evidence-Based Policymaking. It took a number of years to become law. As many of you who've watched Congress know, things often take a little bit of time, and in some cases that's really good. And I would say that was actually exactly what happened with the commission bill, is that it got better through the course of its time on Capitol Hill. And so some of the important themes that we're going to talk about this morning, particularly around privacy, were really included as directives in the legislation that Congress passed and that President Obama signed back in 2016, ultimately creating this commission. So what I want to do this morning is introduce you to three experts, not just in the commission, but actually in evidence-based policymaking broadly. You've already met Naomi. We're going to talk a little bit about the commission's recommendations, the process that the commission used to develop those recommendations, and importantly, some of the implications for this work going forward. So Katharine Abraham, to my left, was the chair of the Commission on Evidence-Based Policymaking. She was an appointee of President Obama, and she co-chairs the Bipartisan Policy Center's Evidence-Based Policymaking Initiative. and is currently a professor of economics and survey methodology at the University of Maryland. Ron Haskins was the co-chair of the commission, was appointed by Speaker of the House Paul Ryan, and currently co-chairs BPC's initiative with Katharine, and is also a senior fellow at the Brookings Institution, and I just add a longtime staffer to the House Ways and Means Committee. And to his left, who you all know already, Naomi Goldstein, the Deputy Assistant Secretary for Planning, Research, and Evaluation at HHS's Administration for Children and Families. So thank you all for joining this morning, and really looking forward to our conversation. I want to turn first to Katharine, who, as chair of the commission, really helped think about how to implement the charge and the direction that the commission would take. Can you tell us a little bit about what that charge was that Congress prescribed, and who was on the commission?
Sure. Good, this is working. So the charge that we were given was, of course, around improving the federal government's capacity for evidence building. A lot of the charge that we were given focused on an issue that had been identified as an important barrier to developing evidence for policymaking, and that was access to the data to do evaluation. So our charge had a number of elements. We were charged to look at the existing data infrastructure that feeds into federal policymaking. We were charged, importantly, and this was really central to what we ended up doing, to determine the optimal arrangements for which administrative data, survey data, and related statistical data series may be integrated and made available for evidence building while protecting privacy and confidentiality. We were asked to consider whether a way to do this might be to set up a data clearinghouse where people could access program and survey data. And then we were charged with recommending how to incorporate evidence building into program decision making. So we were given, in the end, a little over a year to do this. It seemed like a pretty big charge to try to tackle, but that's what we set out to do. Nick's already alluded to this. You might think that if you were putting together a group of people to look at these issues, that you would want people who work on program administration, who work with data, who do research, and 2/3 of the people who were appointed to the commission were appointed on the basis of having that sort of background. But the framers of this legislation also realized that if you're talking about making more use of data for good purposes, you need to worry about protecting the privacy of the subjects of those data. So 1/3 of the people who were appointed to the commission were people who were there because of their background in the area of privacy. So we were a mix of people who were people who work with data and people whose primary focus is privacy. It made for a lot of interesting discussions, but in the end, we did all come to a common perspective on what we were trying to do.
So Ron, Katharine's described this incredible expertise that was on the commission from the appointed commissioners, and you were the co-chair of the commission. Tell us a little bit about how the commissioners went through the fact-finding process and ultimately developed their set of recommendations.
I found this the most fascinating part of the commission, the whole process, because we spent 8 months talking to the best people in the country about data and research, and especially people who conducted data analysis from the private sector who had a need to get access, especially to large data sets. And they had done a lot of work in this area already. It was, and still is, a time of really enterprising activities in using big data sets to reach very surprising conclusions that we would not have been able to reach without those data sets. So it was very much a timely commission, and the access to big data just kind of symbolizes what we were trying to do to make it easier for researchers to get access to data, especially big data sets. So also the commission, we haven't mentioned this yet, but because we were associated with Speaker Ryan, who kind of runs the House, it's running out of steam a little bit now at this point, but and Senator Patty Murray, who's very influential in the Senate, we were able to get a nice budget. And the first thing you do with a good budget is you get good staffers. Nick is an exception to good staffers, but nonetheless, he turned out to be the guy who actually was, in some ways, the most important because he wrote a lot of the words in the report. He may have written more words in our report than anybody else. But we had a great staff. So when we wanted to plan hearings and get access to information from people and find out what people thought we should be doing, we struck it rich because we just had great people with great connections. And I'm not aware of anybody that we wanted to talk to, either officially, sitting before us, giving testimony and answering questions, or behind the scenes that we didn't get access to. So it was a great process. We had 8 hearings, and I think we had something like 49 invited witnesses at those hearings. Almost everybody we invited accepted. If they couldn't accept for some reason, they volunteered to talk to us on the phone or they talked to staff. And then we did something which I have not heard of very many commissions. In fact, I've never heard of any commission doing this. There probably has been one that's done it. We had 3 wide open sessions. Anybody who wanted to come could come and testify before the commission. We did one of those in Washington, we did one in Chicago, we did one in San Francisco because we wanted to make it easy for people to get access. And they were all interesting commissions. I'm glad we did them, especially one in San Francisco because I heard stuff about privacy that I could not believe. And this was really, in fact, one of the lessons that I learned the most, and this would be good for people in this audience to pay attention to if you don't already know it. Privacy is a much bigger issue than you might think. And there are people who don't care very much about research. I know that's hard to believe, but they care about privacy. And on the scale of access to data for research and privacy, boom, it goes like that. Privacy is all that counts. See, we actually had a witness tell us that the federal government does not have the right to even collect data on individuals. So that'll give you an idea of the feelings. And this is why you have to have hearings, because I really had no understanding of the depth of feeling about privacy. And of course, as all of you know, we've had several instances in the last, I'm going to say 5 years, but probably more than that, where privacy has really gotten a national attention, and it becomes a more intense issue all the time. So privacy is something we really have to attend to. Nick mentioned that 5 members of the commission were appointed because of privacy. I would say that 3 of those 5 were true believers in privacy. It was something like a religious perspective to them. And we needed them on the commission, and they were really good. They were amazing. I could not believe the stuff they knew. And so we paid a lot of attention to them. Especially one of them was kind of on the edge of the commission all the time because he believed so strongly in privacy, but eventually he came into the fold, and I think the commission report was much better because of him. We also put a notice in the Federal Register and requested comments from anybody who wanted to make a comment. We got 350 comments. Thankfully, the staff summarized the comments for us, so we didn't have to read all those comments. We also did a survey of federal agencies, 209 federal agencies, and we got information from the agencies. And then in addition to all that I've just described, we had more than 40 meetings with other groups of interested parties, especially researchers. So following this fact-finding and condensing this information and reading all sorts of reports and having lots and lots and lots of discussions, we went into private sessions, and for the rest of the, I guess, 5 months or so of the commission, we had private meetings, and we tried to condense its information and make recommendations. And we came up with 22 recommendations. I was a fan for 10, but like most other issues, I lost. But we have 22 recommendations.
We got it down from 53.
Yeah, I think that's probably right. We got it way down. And to be honest, when I look back at them, I do this all the time. I can't think of any that I would want to eliminate. So there are 22 very interesting recommendations. We're going to chance to talk about those in just a minute. And here is the most important thing I have to say, and that is that despite, and after all of this and all of the, especially, I'm going to use the word intense negotiations behind the scenes between commissioners, especially over privacy, but over a bunch of other issues too. In the end, all 15 commissioners signed a report, and I would give about 92% of the credit to Katharine, because she seems to be real nice and easygoing, but when you get in a clinch, old Katharine knows how to convince people, and she can be velvet glove, but she can also whack them So it was a very interesting process. Katharine was great, and we got all 15 commissioners to sign and report. I think the last commissioner signed about 8 seconds before the deadline, but we got everybody to sign. So I think it's a real achievement.
Thank you, Ron. So Ron's described a little bit of the fact-finding process of the commission, and Naomi, you testified in front of the commission in one of the meetings around specifically the topic of program evaluation. Can you tell us a little bit about the experience? What did you tell the commission, and do you think that they sort of addressed your concerns?
Sure. So I made a number of points when I testified, and to boil them down to one main message, I would say that data alone are not evidence. It takes a lot of planning, skill, effort, and analysis to turn data into evidence. And to carry out that work at the federal level, we need statutory authority, funding, a skilled government workforce, and a robust private sector. I imagine the same factors are needed at the state and local level, too. So when I testified, just before I testified, president of the W.T. Grant Foundation testified, and I remember that he said to the commissioners, "Be the evidence commission." And what I think he meant was similar to my point, which is don't be just the data commission. Not to minimize the importance of data and the complexity and challenge of producing high-quality data and making it accessible, but my interest lies more on the side of using the data. And in fact, the commission did come out with some very strong, very important recommendations related to evaluation and building federal evaluation capacity, which was my hope for the commission, so I was very happy about that.
Very good. Well, that's a good segue to talk a little bit about the broader vision that the commission outlined. And Katharine, you were really instrumental in guiding the commission through the process of developing this vision before any single recommendation was agreed to. Can you tell us a little bit about what the vision is, and what was the process like for getting folks to agree to this broad vision?
So I think we all of the commissioners came in with a general sense of what it was we were trying to accomplish. But at a certain point, we decided that it would be a good idea to be explicit about that. So a subgroup of us went off and wordsmithed this vision and came back and had discussions with the rest of the commissioners. Maybe I could just read this vision, because I think it encapsulates what it is we were trying to do. What we said was that the commission envisions a future in which rigorous evidence is created efficiently as a routine part of government operations and used to construct effective public policy. So there's a number of elements to this vision that I think were important in guiding all of the rest of what we did. One thing was that we were talking about being able to generate rigorous evidence, that we were interested in research that actually let you understand what was going on with program implementation and draw conclusions about what was working and what was not working. So the rigor was an important part of what we were talking about. We were talking about generating evidence efficiently. There's a lot of research that goes on now, and in many cases, the model for doing evaluation research in particular is a model where someone comes in, they propose a study, it's designed from scratch, carried out from scratch. Somebody goes out and collects data to carry out the study. So it's in many cases a lot of one-off evaluation projects, and then you go to the next evaluation project, and that's a new thing. Our hope was that this could be made more efficient, that there could be an infrastructure in place that facilitated doing ongoing evaluations. So that was an important part of the vision. That sort of goes along with this being a routine part of government operations. This isn't, in our view, evaluation isn't something that should be done a little bit here, a little bit there. It's something that should be done on an ongoing basis as a routine part of operating programs. And then these evaluations, this evidence should be something that's used to construct effective public policy. So those elements were really what guided the rest of the discussion and the recommendations that we came up with.
Great, thank you, Katharine. And Ron, in relationship to the vision, the commission also outlined a set of principles, and I just want to put those up on the screen now. And just for the sake of time, we won't read through all of these, but I was interested in your perspective on how valuable these 5 principles were for shaping the commission's recommendations.
On a 10-point scale, about an 8 or a 7. I mean, they were valuable, but they didn't completely guide the commission. And some of them were way more important than others. So they were important, I think, but the processes in the commission and what we heard in testimony and so forth, I think, was more commission. But let me say a few words about them anyway, because I'll try to touch upon how important they were and how they were important. I've already talked about privacy. There's no question that this was very important. Some people would say the most important, because there was a certain level of fear that if we didn't get the privacy right, and if the research community does not get the privacy right and have adequate appreciation and make sure that we have, and we're talking about some very technical stuff here, in fact, stuff that I don't understand very well. Fortunately, we had people on the commission who do understand it, and it's a kind of chase, because it's people who want to get access to data and use it for bad purposes are constantly inventing new ways to do it. So the folks who want to protect the data are chasing them and trying to protect the data as they're getting. And this is just, goes like this. So that's a constant ongoing process. So privacy is very important. It's a super important principle. And that was right at the top of our agenda throughout. Rigor, of course, would be expected by everybody in this audience, because researchers know that the reason we undertake the scientific enterprise is because we want to be right. We want to get the answer right. And experience shows us very clearly, if you're not rigorous and don't follow rigor in your procedures, you're not going to get the answer right. We have the history of social science especially is full of examples showing how important rigor is, and when you violate the principle of rigor, you pay a price for it. Transparency, I think, is more recently something that people are really concerned with, because we are concerned with the public. Ultimately, the public pays the price. Their taxes support much of our research at both the state and the federal level. So we want them to understand what's going on. And to the extent that we're in an ivory tower or in some government agency and the public doesn't understand why we're doing what we're doing and how important research is and what a role it can play in public policy, I think we're going to be much the worse for it. So transparency was very much a part of the procedures of the commission. We wanted to be sure that, we had to negotiate in private and set the recommendations in private, but I think on the whole we were very open. All the important stuff was in our report, and the report is full of transparent information about how we made decisions and why we made them. So I think we lived up to that one as well. Humility? What? In Washington, D.C., humility? I couldn't. I thought when it first came up in the commission, I just kind of chuckled and said, "Wait, you guys are kidding, right?
Yeah,
Humility?"
I love that word, actually.
Yeah, well, I like it too, but not in Washington, D.C. Nobody here is humble. There is one respect, though, in which I have come to appreciate the concept of humility, and that is, I have learned through the years that mostly our programs don't work. And the better research we do and the better evaluation we do, we discover that our programs don't work. So all these grandiose claims, all of you are familiar with this, about various programs and the miracles they produce in child development and school achievement and so forth, we find out 3 years later or 5 years later that it's not right. So I think those of us who do research in the social sciences, and especially program evaluation, have a lot of reason to be humble. And even when we find significant findings, it's good to be humble, because the next generation could show that they're minor findings and we can do a lot better than that. So I think there is a reason for humility. And then capacity, of course, is a big story. We'll talk more about this in a minute. We have some recommendations about capacity. Let me just make one point here that everybody in this room should understand, may not have reflected on it too much, but we are at the limit of our capacity in many respects, especially money. I've been saying this for years, and yet Congress keeps spending money hand over fist. And this year, last year, they even did one better, because they not only spent a lot of new money, they cut taxes too. So The Chinese gave it to us, and the Saudis, and who else. But I do say the principle here is at some point this has got to end. So we've got to make better use of our resources. I think that's really the key here. And if we can't do that, the capacity that the federal agencies need and that researchers out in the countryside need, at some point it's going to be seriously constricted. And I think we will all pay a price for that in the long run, because I think we're at a time now when our research is becoming more and more important, and when the connection between research and policy making and practice is becoming more and more fluent. And it's just at this time that I think we're entering an era where we could have a real problem with capacity, and there could be cuts in budgets. In fact, there have already been pretty serious cuts in the children's budget over the last 4 or 5 years until the budget we just passed in December. So capacity is a very big deal, and we're going to have challenges immediately ahead.
So said another way, you are all really important, so keep doing the work that you're doing. We really need you. Naomi, you of course have been leading the efforts in the Administration in Children and Families for a number of years, and I'm curious about your take from the vision statement and the principles that the Commission laid out to give us a little bit of perspective for folks that are working in government or closely with government. How valuable are those kinds of statements coming from a unanimous bipartisan commission to really set the tone for this work going forward?
So I would say very valuable. I am a fan of broad principles. I think they can be extremely useful in helping to prioritize and organize action. And as many in this room know, because I take every opportunity to reel them off, ACF has established an evaluation policy with 5 principles: rigor, relevance, independence, transparency, and ethics. And 2 of those principles are the same as the Commission's principles.
No humility?
No. We're civil servants, so we get that reinforced every day. So, okay, but I am not sure that the Commission's broad principles have actually attracted a great deal of attention within federal agencies. I think the concrete recommendations of the Commission and the potential requirements that may follow in statute have seemed more compelling. I think the principles could gain traction over time, especially if you choose to continue emphasizing them. I think that people underestimate the amount of effort and repeated communication that's necessary to make something like this salient. So, for example, I'm sure that I have mentioned ACF's 5 evaluation principles at each of the last 6 conferences since they were established, but probably only the OPRE staff could actually recite them. So you would think I had, promulgated them pretty aggressively, but you have to be even more aggressive than you think if you want something like this to be reeling off people's tongues. So for the ACF evaluation principles, I've put them on M&Ms, I've put them on tote bags, most recently baseball caps. No government funds were used to create this swag. But I guess I would say back to you, if you want these principles to be out there, you've got to be relentless. And I do think that the principles and the vision statement are, I think you captured a lot of some important elements of the zeitgeist in federal evaluation circles. And I'll go back to the notion of capacity in a different way, and I think in terms of institutional infrastructure and capacity to generate and use evidence, which may seem like an obvious concept, but I only started to hear about this as a notion 4 or 5 years ago, and then people kept talking about it and started to identify some of the elements of evaluation or evidence capacity. And I do think it's a really important concept and worth repeating.
All right, thank you, Naomi. So let's turn now to talk a little bit about the deep substance of the report. We've alluded to all 3 of these major themes that came across in the Commission's final recommendations, but I think it's important to just reiterate these right here. The Commission specifically acknowledged that There are many challenges around accessing data that government currently collects, and you'll see a series of recommendations come out of this theme. Ron alluded to the importance of privacy protections and the wealth of information the Commission acquired and learned about some of the challenges, whether it's de-identifying data or simply making sure that data are protected under the legal infrastructure of law, and made some very specific recommendations there as well. And then we've just been talking a little bit about capacity. So even if the access for data is improved and the strong privacy protections are in place, we know that capacity is always going to be really critical to execute on this work. I want to turn first to Katharine to give us a little bit of insight about the recommendations specifically in the access to data and privacy protection themes.
Thank you, Nick, but before I turn to that, I do want to say M&Ms. I really like the idea of M&Ms with our principles on them, more seriously. As I already mentioned, the Commission spent a lot of its time talking about issues related to data access, which were integrally entwined throughout our conversations with issues related to privacy. We were trying to come up with a way to set up a structure that would give researchers, program administrators, better access to data for statistical and evaluation purposes, while also being sure to protect the privacy of the subjects of those data. And I think for some of us, at least, our starting point was that the way that you would do that would be that you would create a data bank somewhere in the federal government, and you would pull into that data bank all of the relevant data on people's earnings, data on people's participation in programs, and then when someone had a project, they could come into the data bank and all the data that they needed to do an evaluation would be there. We quickly realized, however, that was really just a non-starter. That was actually very similar to a proposal that was made back in the 1960s by a group of a project, a commission. It wasn't a commission, a blue ribbon panel that was charged with making a set of recommendations, and that's what they recommended. People went crazy. You mean the federal government is going to compile all of this information about me and my family, and it's going to be sitting in a big data warehouse, and anybody could break in and do things with it? And it was actually that proposal, as much as anything, that led to the Privacy Act initially back in the early 1970s. So we decided we were not going to recommend that. We can learn from experience. What we recommended instead, as a vehicle for providing program administrators, researchers better access to data, was the establishment of something that we called the National Secure Data Service. You can tell we were a bunch of fairly nerdy people. We otherwise could have come up with something that had a bit more ring to it, but it captures what we have in mind, which is that we would set up a facility that had expertise with respect to where relevant data are, developed relationships with the holders of data. When somebody had a project that they wanted to carry out, the project, if approved, they would come into the National Secure Data Service. The data that they needed for their project would be pulled together, the project would be carried out. When the project was completed, the data would be disassembled. They'd still be held by the original holders. The project could be replicated if needed. But that's the basic model that we came up with in terms of data access. But as I said, we were also concerned about privacy. Ron and I and some others from the Commission were testifying before the Congress about our proposals, and one of the questions that we got from a member of Congress was basically, this National Secure Data Service, would it be something that could be used to root out fraud and abuse? And the answer to that is no, that what this National Secure Data Service would be designed for is for projects that are statistical in nature, meaning that they're projects that are designed to generate evidence, but not projects that would have implications for particular individuals. And so that's an important part of what we were recommending. Any data that were assembled by the National Secure Data Service would, by law, under our proposal, be used only for statistical purposes. One of the impediments to access to data currently is a set of laws that are on the books that are either unclear about whether data that are collected for program purposes can be used for evaluation purposes, or explicitly prohibit the use of data for evaluation purposes. So we recommended that those laws be reviewed and, as appropriate, revised to authorize the federal government to compile and to use confidential data for approved statistical and evaluation projects. The federal government currently releases quite a lot of data that it collects. In many cases, the people who are charged with releasing data sets don't necessarily have a background in privacy, and so there have been cases where data have been released that people thought were de-identified, but that it then turned out were not effectively de-identified. The best example of this that we heard about during our deliberations is not actually a federal example, it's a state example. The state of Massachusetts had been releasing de-identified health records for research purposes, and one of our commissioners actually was able to, they didn't have any names or addresses or anything, but there was a county on the file, and you knew how old the person was, and you knew whether they were male or female. She was able to go into those records and identify that one of the records on this file that had been released was the record for the governor of Massachusetts. And she pulled out his record and sent it to him, and it was a way to get attention to the fact that if you're going to be releasing data files, you really need to go through a rigorous review to make sure that the information you're putting out isn't going to let you identify any particular individual. So that was something we recommended. And then going along with that, we recommended that as we move forward, that the federal government, the people at the National Secure Data Service, others using these data, adopt the most modern privacy-enhancing technologies. That can involve a number of different things. If you put data sets out in just for people to work with and you just leave all the information exactly as it came in, the odds are that there's going to be people in there that you could identify. If, on the other hand, you add noise to the data, you could do that in a way that still lets you use the data for research, but prevents you from being sure who any person on that data set is. That's just an example of the sort of privacy-enhancing technologies that we had in mind. So it's access to data in a way that we thought would protect privacy and therefore make this a viable and sustainable enterprise.
Thanks, Katharine. Ron, you've alluded to the importance of capacity in all of this work. Tell us about the capacity recommendations.
I still can't believe the example of LaTanya was her name, who figured out the governor's information. Yeah. They had a big argument about the company that did it said it was secure. No one could ever possibly solve this data set, and it was all secure. And so she gets the information from the governor. Guess who won that debate? It was amazing. So capacity, very important set of recommendations. They're among my favorites. I really like these recommendations, especially the first two, which directly concern people in this room. The first one is that federal agencies, and we didn't take too much time to identify exactly what an agency is, certainly at the level of the cabinet level agency, but perhaps under that as well, should have a chief evaluation officer. I have a military background, and I've come to believe that the chain of command is really a crucial part of any organization. So there ought to be someone who's really in charge of the data, and they have responsibility for figuring out how to get it, how to protect it, how to use it well, how to make it available to their staff, and in many cases make it available to people outside the agency. So chief evaluation officers are very important. We ought to have them throughout the federal government, and we should give them some power to have influence and be able to shape the agenda of the agency. Would never be superior to the capacity of the secretary, but I think many, probably most, maybe nearly all secretaries would be willing to cooperate on these kind of operations if they can get along with the chief evaluation officer. The second thing is we've got to make sure the chief evaluation officer knows what they're supposed to do. So every agency should have a learning agenda. That's another recommendation that we made that I think makes a lot of sense. I have often had trouble figuring out, not in the case of Naomi or anything to do with ACF, of course, but with other agencies, what are they up to? It seems to change, frequently, and I can't figure out what. Whereas if we had an agenda that were clear, and especially if we had an agenda that lasted from year to year, not that it would, it could change, but that it would have a certain consistency to it, and if we were really smart, we could do it across administrations and have goals that even transcended administration, so we'd have really long-term goals that we would constantly be working toward. I think this would also help our PR people because they can explain to the public, here's what we're trying to do, and here would be the advantage if we knew how to do it. So these learning agendas, I think, are really important, and once we get started doing it, I think a lot of people in the agencies will learn about how to do a good job of this and how they can use it to motivate the people in the agency, bring clarity to people working in the agency, so this is a very important thing. Then we decided we'd give the government a job heretofore thought to be impossible, and that is coordination. So we want to improve coordination of government-wide evidence building, and of course we would put the Office of Management and Budget in charge. I often talk about the Office of Management and Budget and explain it to people outside Washington that they're the quarterback of the federal government, because in many cases they are. They have enormous power, and unless they are really effective and know what they're doing and are able to do it, we are not going to be coordinating at the federal level. So we specifically mention the Office of Management and Budget and give them additional authority and powers to make sure that we have this coordinated national agenda. And very similar, we want to align administrative processes, especially having to do with procurement. I don't know as much about this as I'd like to, but I know that we've had testimony about this. We have a lot of problems with our procurement processes, and they should be aligned across agencies as well. And then finally, we'll come back to something that I talked about a few minutes ago, and that is to ensure that sufficient resources are available. And in the environment that we're in now, and I think will be in increasingly in the future, we need a very wise strategy to make sure that we have enough money to do the research and to promulgate the research. And one of the most creative ways to do that, I think, is that we have set-asides, percentage set-aside within agency budgets that are guaranteed to be devoted to research. Now, I think in many cases that still will produce a smaller budget year over year, not every year, but in some years, but it still will guarantee at least a minimum sum that the agencies would have to continue the work that they've already started. So I think that's a very wise thing. Labor does something very close to that already, and I think other departments should be able to do that, and Congress should support it. I find that members of Congress have not reflected greatly on this idea that the budgets are going to start going down in some agencies, and as I've said, they've already gone down in some children's programs. In fact, the total amount of spending until last year went down. Now things can start going down again now. So we have to learn to deal with this, and we need to learn what we want to preserve, and I think that research should be right at the top of that, and this would be a way to do that. We'd still take a cut, but it would be modest.
Thank you, Ron. So Katharine, there were a couple of specific recommendations about states in the mix too, and I want to give you an opportunity to, in particular for this audience, to highlight what were the things that you think were the most relevant for states to know here?
I think there's really two main things. One thing that the Commission realized as we got into our deliberations is that a lot of the data that anyone wanting to do program evaluation work in the federal context, a lot of the data that are relevant actually are collected at the state level, not at the federal level. For many evaluations, one of the most important outcomes that you might be interested in looking at would be what the impact of an intervention is on people's later earnings. In many ways, the best or one of the best sources of those information on earnings is the wage records that are collected as part of the administration of the unemployment insurance system. But there's no place at the national level where somebody wanting to do program evaluation can easily access those data. It's a very odd situation. The federal government holds those data in two different locations. They hold them in the National Directory of New Hires, but the uses of those data are very limited. And then the Census Bureau has assembled them, but they can only be used there for Census Bureau purposes. So we were very interested in finding a way to make that kind of information more available, more readily available for evaluation purposes. So that was one of our specific recommendations. There's a lot of other program data that anyone wanting to do evaluation would want access to. Data on Medicaid participation, data on TANF participation, data on food stamps. But those data don't always flow up to the federal level, and our recommendation was that, in that area, was that states that are implementing programs that receive substantial financial report should be reporting to the federal level on the people and who are participating in those programs. So that was one set of recommendations, which was that we would like to see data collected at the state level in the course of implementing federally supported programs be available at the national level. The other thing that I think is relevant for states, though, is that if this all actually happens, it's an enormous resource for anyone working in state government. Our vision for this National Secure Data Service is that it would be a place where someone in a state who was wanting to evaluate what was going on with their programs and make comparisons between how their program is working with what's going on in other states could come and access the data that they needed to do that. I mean, at this point, if you're working in a state, you may or may not be able to get data for your state that's relevant to trying to do an evaluation. But getting data for any other states to benchmark against is going to be much, much more difficult. And we see this as a way to address that issue.
Thanks, Katharine. So you all have just heard about the headline recommendations of the Commission. There were 22, they were unanimous, they were bipartisan. I don't think we actually mentioned all 22 through the course of the discussion, but I would encourage you to take a look at the report if you're interested, because underneath the 22 recommendations, there's probably another 50, 100 sort of buried in the text of things specifically that agencies and states can consider doing. I think if you take them all together, it sounds to me like the Commission had this holistic vision of how to really tackle these tough challenges that, whether it's the access, the privacy, the capacity issues. And I think the takeaway for me is that we have to think about this a little bit as an ecosystem where whether you're at the state level in a federal agency, a chief information officer, an evaluation unit, a statistical unit, there's a role here for everyone. And the Commission really made this clear that we need folks to work together if we're going to be serious about tackling these challenges and better making data available, then using those data to actually guide policy. So I want to turn to Naomi actually on that exact point and talk a little bit about the next steps from the perspective inside government. What do you think the Commission's recommendations really mean for agency work, for your work in particular? And has this broader suite of recommendations been useful to you so far?
So yes. So the Commission's recommendations, and as I mentioned, the prospect of potentially being required by law to implement some of them has certainly pushed us to make progress in some areas that may not have been top priorities in the past. So, I mean, I do think much of what we do, I would take the Commission's recommendations as validation and reinforcement, which is also really useful. So it's great that some of the recommendations cover things that we're already doing, but the recommendations have also focused us in some other areas. So for example, we have developed and will soon publish an inventory of ACF databases, which we hope will be useful. We've had most of the elements of a learning agenda process in place for some time, but we're moving toward formalizing that process, making it more coherent and more transparent. We launched the TANF Data Innovation Project actually in September, around the time that the Commission's report came out. The project has many ambitions. It's currently planning a couple of data collection efforts to understand current state capacity and challenges in using TANF participation data for performance reporting, for research, for evaluation. The project will be conducting key stakeholder interviews and a state needs assessment. with plans to use those results to plan and design technical assistance that will be truly responsive to state needs. You can learn a bit more about this at a 1 o'clock session today on the power of integrated data. And you can also sign up for the TDI Learning Collaborative. There are information sheets scattered around the hotel, so keep your eye out for that. I also want to mention a new statutory requirement that's quite relevant. The Bipartisan Budget Act of 2018 directs HHS to designate data exchange standards for certain categories of information in the TANF, child support, child welfare, foster care, and maternal, infant, and early childhood home visiting programs. And it requires HHS to issue regulations in covering some of those areas. So we'll be doing that, and certainly we'll be having an eye on the Commission's recommendation as we move forward with that process. And then lastly, I'll just mention an HHS-wide effort. The HHS Office of the Chief Technology Officer is undertaking an effort to promote and streamlining data sharing within HHS across HHS programs, which kind of speaks to the complexity of the ecosystem we're all involved in. Even sharing information within the federal government can be quite challenging.
So lots of great work happening inside ACF and inside HHS, it sounds like. Katharine, you were recently involved in an effort as a former head of a statistical agency. There was an endorsement statement that came out from a bunch of statistical agency leaders of the commission recommendations. I'm curious what your sense is. I mean, obviously you were biased because you were the chair of the commission, and so of course you were going to sign the letter, but the fact that so many former heads of statistical agencies have come forward and mentioned specifically the value of these recommendations, what does that mean in the broader context here?
Well, I think one of the things that's going on is that for people working in statistical agencies, traditional means of collecting information are becoming more and more difficult. So for a long time, the statistical agencies have relied very heavily on surveys of households, surveys of businesses, but it's getting harder and harder to collect reliable information from people, from businesses. And there's growing recognition that moving to the future, that increasing reliance on administrative data is going to be a big deal. You can see the reason for concern in some recent research that's been done. If you look at statistics on program participation derived from survey data, they are becoming increasingly inaccurate. So if you compare what comes out of surveys to what comes out of administrative data, you just see that you're missing a lot with the surveys. So that, among other reasons, is, I think, part of why people in the statistical agencies were so enthusiastic about these recommendations that would give them increasing access to administrative data from a whole variety of sources to produce better statistical information.
So we're not just talking about endorsements. There is actually some legislation moving to implement some of the recommendations from the commission. Naomi's alluded to it. Ron, can you tell us a little bit about what's happening in Congress?
Yes, one of the distinctive aspects of the commission was that we had a close relationship with both the House and the Senate throughout our proceedings. They did not interfere with us in any way, but we worked with their chief staffers who passed the original legislation, so they were involved. They continue to be involved throughout the process. They're still involved. And they're both very experienced Hill staffers. Many people in this room know how important Hill staffer is if you're trying to get something done up there on the Hill. One worked for the Speaker and one worked for Senator Murray. And we were working with them from the day we started. We had lunch with them. We heard about their rendition of what the Speaker wanted and what Senator Murray wanted. And we continued to work with them. Perhaps the most important thing they did was, as we approached the end of the commission report, they worked with our staff. We met with them, but they mostly worked with the staff. And they worked with the staff of the committees of jurisdiction in Congress. And especially in the House, they drafted legislation. And let me make a point here. If you could have a great commission and make spectacular recommendations, if you can't get something done in the law, you might minimize the chances that your recommendations will have serious impact. So we wanted to do this from the beginning, and we had great guidance. and they shaped the legislation, working with the legislative staff, which you can't offend the legislative staff. They draft the legislation. So we worked with them through the Speaker's office and through Senator Murray's office and drafted the legislation. They also arranged for a hearing. We had a hearing within something like 15 minutes after our last meeting, and recommendations were very quick. And Katharine was the star of the hearings, and the committee was great. I think something like 15 members showed up, which is unusual. They asked pretty good questions. And we had 4 or 5 of our members there, so it was everything got off in a quickly. And then they wrote the actual legislation, which they've been working on all along with our staff, and they brought it out of committee by unanimous vote, and they brought it to the floor of the House, and it passed by unanimous vote. So what more could you want?
Senate action.
Senate action, exactly. You've been here more than a year, right? So, now look, I'm a House guy. I was there 14 years. The Senate, the word imponderable was invented for the United States Senate. You just don't know what they're going to do. And I still don't know what they did, but it stopped the legislation. And as far as I can tell, there's no serious objection to it. In fact, through Nick's work and work of others, especially the staffers that were helping us on the Hill, the bill got into must-pass acts at the end of the last session. And mostly, I spent years trying to do this, get stuff out of that kind of bill, and you can't get it out. Well, someone figured it out, and they got it out. So it hasn't passed yet, but I'm still optimistic that it will, because it just does not have serious opposition. Now, it's not a big, huge provision. A lot of members of Congress probably don't know anything about what I just described, but there are people, important people, who are in position to influence things. They've already signed off on it. And if a couple of them will get together and really push it, I think we'll be able to get it through the Senate. And it helps, especially that there apparently, Nick may be able to say more about this, there's no substantive reaction. So let me just tell you about a few of these provisions that I think could make a difference. The first one is, Katharine has mentioned the National Security Data Service several times. I don't have time to go into it in detail, but that could be our major provision. That could really have huge long-term impacts in coordinating all kinds of data from lots of agencies and making it available both to federal investigators and to investigators from the private sector while maintaining privacy. That could really be an innovation. And we're not taking a chance on establishing that because it's going to be very controversial when it passes. But a step toward it is in the legislation. That would be an advisory committee. That would be a very good thing. The second, we want to make data maintained by federal agencies available to the extent practical. That is in a sense, that's in many ways our major goal is to make data available. So that would be a good provision. We also want to develop inventories. You may be noticing, I sound like Naomi here. I'm describing to you things that HHS has already started to do. So that's a very important provision. And I've already talked about the Chief Evaluation Officer and the learning agendas. Both of those are in the legislation. So there are a lot of good provisions in this legislation. About half of the recommendations of the commissioner in that legislation. The vision of the Speaker and of Senator Murray was we pass this one, get it done last year, introduce a new bill this year and get that passed this year, so Congress would not have to absorb a lot of things that might be controversial in one gulp. So that approach has not worked so far. But I think eventually we'll get most of the provisions passed, and it will make a very big difference. Nick now, his full-time job is to make sure this gets passed. And we have a group at the Bipartisan Policy Commission, and they completely agree on this. They're helping us do everything they can, so I think we've got a good chance.
So the bill is called the Foundations for Evidence-Based Policymaking Act, H.R. 4174, if you're interested in looking it up. About 10 of the recommendations from the Commission are addressed in some way, so it's not everything, as Ron alluded to, but there are a lot of really important features that the Commission made specific recommendations on that folks in Congress have really started to try to figure out how to incorporate into that legislation. So we have some time for questions, and there's a lot to dig into here, so we really want to encourage any questions that folks have both in the room and for those online. I understand you can submit questions via email through the webcast system. That's all I know about it, so somebody else will have to give more details. So let's open the floor. What questions do you have for the panelists? And we have microphones for those in the room, scattered around the room. Well, let me start.
Wait, you got one, look at it.
Oh, good, here we go.
Hi, I'm Brett Brown from OPRE, and I was wondering if you all had had time to consider the potential impacts of the European Union's privacy law that just went into effect, and how it might affect our ability to pursue the recommendations of the Commission.
That's a good question, and the answer is that I at least have not. I think, as has already been discussed, our recommendations were very much geared towards protecting the privacy of data subjects. So I think, at least in spirit, how we were thinking about this would not be broadly inconsistent with the direction that they're going. But I at least haven't had a chance to look at exactly how what they've legislated lines up with what we're proposing.
Also, I think we could note that we did consult with several European nations and got all kinds of good advice. And in fact, we had them on the video right in front of us from, I forget, Sweden, I think, and maybe 3 or 4 countries. So we got good advice from them about many issues having to do with data, including privacy.
I think it's important to note here that the European framework for privacy is a little bit different than what we have in the United States, even before GDPR. And so the privacy commissioners were really the experts in knowing this. Paul Ohm in particular had a lot of familiarity with the different models. And so the commissioners did a lot of effort to try to understand what was happening, as Ron alluded to, in some of the European countries, but also recognize that the laws and the framework are actually a little bit different. And so that presented a nice, interesting challenge for us in figuring out how to go forward in terms of structuring some of the recommendations for the Commission. But one in particular that is an undertone that is one of the strongest privacy protections we have for statistical data is called the Confidential Information Protection and Statistical Efficiency Act of 2002, or CIPSE. And the legislation that Ron described that's currently moving through Congress reauthorizes CIPSE and actually provides some of the updates that the Commission recommended around encouraging public trust in statistics, encouraging the availability of data within that strong privacy framework that CIPSE provides. So there are some important relationships to GDPR, and I think that the Congress, or the Commission considered those to some extent, but it was more important to consider the legal framework that existed in the United States. All right, other questions? Go ahead.
Hi, Julie Kirksick from Community Advocates Public Policy Institute. I am not sure if this is a question any of you can answer, but I'll start with Naomi. What you're describing, it's easy for me to see how it would affect research agendas for existing legislation and investments that we currently make. What, if any, influence would this have on the process departments use for dealing with waiver requests? Would it impose a particular analytical framework? Because as I'm experiencing it in the great state of Wisconsin, we are now using waiver requests as a way to push agendas that are based on disagreements about what the current federal law allows. So is this question making any sense?
Well, I'm not sure, but I'll give it a shot. So what I would say is that across programs, waiver authority has traditionally been linked to requirements for evaluation and learning. That's certainly true in, well, the former AFDC child support and Medicaid programs where the waivers are all under the Section 1115 Social Security Act authority, and also has been true in the child welfare arena. I think it's also been true for decades that both waiver requests and waiver approvals are linked to policy priorities at both the state and federal level, and the requirements to learn from them are, are a way to make sure that that we're not just pushing what we think works, but also trying to learn whether it did work.
Okay, thank you.
All right, I think we have a question from online.
Yes, this is a question from the RECS live stream. What recommendations not in the bill would you like to see added and why?
I have a list of 12. Well, I think speaking for Ron and Katharine here, the most obvious is the data service.
Oh, no, you can't do that.
The National Secure Data Service is not included in the legislation and is, I would say, one of the, if not the most important recommendation of the Commission for moving forward in terms of the broad vision. And while there is an advisory committee that starts the process of the data service, it's not there yet. And we know it's going to be hard. It's going to take a lot more work and discussion, which is going to be really important. But that is a critical next step. And then the other thing I would add is, and this has come up in multiple ways through the course of the conversation already, resources are really important. So this piece of legislation is authorizing, it's not appropriation, so there's no new funding that's made available. Ultimately, it's about establishing a culture or encouraging a broader culture of evidence across government. But it doesn't give everybody the money to do it. And I think that's going to be a really important theme in agency appropriations processes to make sure that you have the resources available, whether it's reallocating or set-asides or new money, whatever it looks like, so that good people, you all, have, whether it's contracts or however the work is done, that we can actually execute.
So you've hit two of the three things on my list, which is, I'd like to see there be more of a commitment to actually establish this National Secure Data Service. I'd like to see some vehicle for ensuring that resources for evaluation are available, maybe the model that Ron talked about, which is using some kind of a set-aside model, building in evaluation as an ongoing part of operating programs. But the third thing that I think ultimately is going to be important to address is some of the existing restrictions on how data get used. So if you're doing an evaluation, you want to see whether your program is affecting people's earnings. If you're not going to go out and try to collect it yourself in the form of a very expensive and likely incomplete survey, you need to have access to administrative data on earnings. And there's nothing in the current legislation that begins to address the restrictions on what data can be assembled and used for evaluation. And I know that's going to be a fight, but I think that's the third thing I'd really like to see.
Can I make a general point about this? It applies especially to the National Secure Data Service. And that is that there is, just even if I didn't know anything about the background that I learned as being part of the commission when I first heard about the National Secure Data Service, my reaction would be, uh-oh, this is something members of Congress are going to be really concerned about. Because anytime you collect a bunch of information about people and put it together, they're concerned. So I think it was bound to be controversial from the beginning, and I think that's why the Speaker's office and Senator Murray just took a little step toward establishing a National Secure Data Service. It's going to be controversial. But I think Katharine and I think agree that this is the most important recommendation. There are lots of other important ones, so we make a lot of progress, even if it doesn't get passed. And it will probably, it's the kind of thing, those of you who follow legislation, it may take 4 or 5 attempts. It may be a decade before the thing passes. But it will be a gold mine for great researchers, both within and outside the federal government, if we can get it right.
All right, next question, over here.
Bob Gerga, Chapin Hall at the University of Chicago. So Naomi mentioned that they're addressing the issues of data sharing agreements within ACF. My observation is that data sharing agreements are still the limiting factor in getting, being able to use state and local and even federal data for evidence building purposes. Is there anything and I've read the report, but is there anything specific in the report, or more importantly, I guess, is there anything proposed or thought about legislation that would address the sludge within agencies that prevents data from getting into the hands of those organizations and researchers that could make good use of it?
Ron alluded to this already when he was talking about what's in the legislation that's currently pending, and it's, in it maybe the most important single thing in the legislation, which is that it has a provision that changes the default presumption about whether data that are collected are going to be available for research purposes. And it says very, very, very clearly that unless there's a legal prohibition, they should be. So it's going to be a long, slow process, but I think that one little provision could go a long way towards saying to agencies, this is something that you should be doing. It's not something that you have to worry that if you do it, you're going to get into trouble, and it's something that you should be doing. And I think that will help if this is passed.
And one observation, that the legislation, again, unanimously went through the House of Representatives. So there's already some interesting signals that, folks in Congress recognize this is also an issue that needs to be addressed. So hopefully we'll see the Senate take the bill up soon and begin to make some progress. All right, next question.
Hi, I'm Steve Bell from Westat. Is there in the Commission's recommendations and in the legislation, is there equal emphasis on evidence of effectiveness when trying new things through waivers or other demonstration authority, as well as evidence of effectiveness of what's already, the programs that are out there?
Well, I would say that if you make the data available to researchers, they're always trying new things, especially when you get to program evaluation, which is a big part of Westat's business, and they're testing new programs all the time. So in that sense, it would make it easier to find out if new things work, and if they do, to have more of it. So in that sense, but I don't recall anything, Katharine might, that specifically mentions new ideas.
I can't remember what language there is in the report, but certainly the vision of the commission was that on an ongoing basis, people would be looking at what they were doing, figuring out if it was working, if it wasn't working, figuring out what else might work better. So that was very much in the DNA of the report, though I can't point you to a specific recommendation that says you should be trying new things all the time.
Well, my question is not whether to try them, but whether the effort, the resources, the rigor, testing what works is something universal to new initiatives as well as ongoing programs. Is that how it looks to you,
That was certainly
Naomi?
very much what we had in mind.
In fact, I would say my thought about the commission was always, we think that researchers both inside the federal government and with the state government for that matter, and outside in universities and in private companies, know what they're doing. And we want to make it as easy as possible for them to get access to data and to combine data sets and do all the kind of stuff that we've been describing here. That was our goal. We didn't want to give direction to them in any way. We don't have specific proposals. You ought to really check into this and so forth. So I think in that sense, our whole goal was to facilitate new ideas and new research and especially evaluation. Now, I always thought in terms of evaluation, and I think that's exactly what the report does.
Thank you.
If I could just jump in, it's a little bit of a tangent, but I mentioned yesterday OPRE has a new division, which is the Division of Data and Improvement, that is focusing on interoperability of data for both programmatic and statistical purposes, as well as the accessibility, usefulness, and quality of data. And people often ask me, why is there an "and" in there? Why is it the Division of Data and Improvement? Why not just the Division of Data and Improvement? And perhaps we didn't name it as clearly as we might have, but it's not the Division of Improving Data, although that is a goal. It's the Division of Data for purposes of improvement. So that's very much in sync with your question.
Go ahead.
Hi, I'm Nicole Constance from OPRE. So a lot of the recommendations in the Commission's report seem to focus on building the capacity of the federal government to generate evidence. And the second part of this evidence-based policy thing is actually using the evidence to create policy. And I also think that as researchers, we are trained to sort of couch our findings and limitations and caveats and talk about generalizability, which can make that translation into policy piece really difficult. So are there things in the Commission's report or that came up during the process that sort of take that next step into thinking about how to actually turn the evidence into policy?
Not so much, I would say. The issue you raise is a huge issue, as you may know if you're involved in policy research and the use of evidence to improve policy, because this is a huge issue. How do you actually get it to policymakers and help them use it? And by the way, the Bipartisan Policy Committee is focused on this issue right now, and they have some fabulous ideas about how you can do that. Some of them are a little wild, but it would be, pipe the results right into things like the Appropriations Committee to make sure the money goes where the research is the most important. So there are other parts of Washington that are thinking about that. It's a very timely question, but I don't think our commission addressed it. Now maybe Nick's going to come up with something that might be important.
So I'd say there are two recommendations that specifically allude to use. I mean, aside from the vision itself being very explicit that the goal is ultimately use of evidence. Recommendation 5.1 and 5.2 have a chief evaluation officer and establish a learning agenda. Those are really all specifically leading into not just the generation of evidence, but the coordinated use. So if you've got an evaluation officer that can help facilitate at a senior level in an agency what resources are available, what research exists at important policy discussions, that ensures or can help ensure that evidence at least has a seat at the table. Learning agendas similarly are a way that we can have policymakers help us articulate what do they need information on, what do they want to know in order to actually inform their decisions. Are they perfect? Are they guarantees that evidence will be used by policymakers? No, but there's no guarantee. Right, so much of the work of the commission and the legislation, again, as I said, is about a culture, and this is going to take time where we've really got to think about strategically how to encourage these uses. Ron mentioned a report the Bipartisan Policy Center just put out called Evidence Use in Congress, and I'd also encourage you to look at it. It's not what we were here to talk about today, but it essentially talks about some of the really specific challenges that Congress as an institution faces in using evidence. And let's just say it's very complicated. But there are real solutions for things that we can do to start making headway in Congress if folks want to take action. So thank you for the question.
Thank you.
Wait, let me just say one more thing. Both the things that Nick mentioned, the learning agenda and the chief evaluation officers, they're dependent on the essence of the question you're asking. What they want to do, what they decide to do, what their agency decides to do, depends on how directly they're connected with the policymakers. And those connections are, I would describe them as loose. So that we still are left with the fundamental problem, which is how do we really improve the communication with policymakers? And I would see that, having worked with policymakers a fair amount, because I was on the Hill for 10 years, 11 years, is a two-way street. A lot of them don't know exactly what they want. They don't really know much about the role of research and how it could influence the agenda and so forth. So if there were established relationships with the committees of jurisdiction, which is the essence of what the Bipartisan Policy Commission is recommending, then you would have a two-way process, and both the staffs and the members of the committees and whatever agency is doing this would have a more direct communication, and that could have the effect of improving the learning agendas and making sure that the work that the agencies undertake is more directly related to what the policymakers want, and that the legislation and that the authority to use the money is more directly related to making sure that that can actually happen.
So in our final couple minutes for this panel, I just want to ask each of the panelists to briefly, very briefly, describe what you think the biggest challenge is for this work going forward, and what's the quick answer for how we solve it? I want to start with Naomi.
Okay, briefly. Focus, ownership, and momentum, and I think the role of OMB will be critical.
That was very brief.
Yes, I certainly agree with the OMB role. I wish I knew more about what they're going to do, and I wish I knew more about the depth of their commitment to what the Commission has recommended. But everybody in the audience is going to play a role in it, because the agencies, we've not emphasized enough how important the agencies are in Washington. They're very powerful, they're very influential, they're full of very smart people who've been around and know what they're doing. And in the end, they have to be a very big part of the implementation. So the people in this room are going to play a part completely independent of what the other people do. So take heed.
Katharine?
Getting legislation through Congress to fully implement these recommendations. That said, I'm actually more optimistic than that. I think there's certainly reasons to be concerned that what we talked about in the report isn't going to move forward, but there's also an enormous opportunity to do a lot of what we've recommended, even without legislation, even potentially without a lot of additional resources. And I thought, in talking about what's already going on at HHS, Naomi sort of laid out a model for that might happen. There's nothing to stop agencies from working, internally to figure out how to share more data. There's nothing to stop agencies from doing a better job of inventorying their data resources and making data more available. There's nothing to stop agencies from developing learning agendas that guide research more effectively. And I think we are starting to see a lot of interest across the federal government, and I know states are doing amazing things to move in this direction. So I'm actually, I sort of feel in many ways that this report was just another part of the movement that's already occurring, and I feel confident will continue to occur in the direction that we talk about in the report.
So on a note of optimism, for those of you that have been watching closely, to Katharine's point, that agencies can do a lot of stuff today to implement some of these recommendations or begin making headway. ACF is a great example of one of the leaders in the federal government, I think, of a place where we've seen a lot of progress that's been really, really incredible over the last several years. The President's management agenda from the Trump administration is actually encouraging some of these activities that align with some of the recommendations of the Commission through a data goal, the development of a data strategy, which specifically talks about things like learning agendas and the evaluation function in government. So there's a lot of positive signs across the executive branch today of where we're seeing potential progress on implementing the recommendations. Obviously, we're optimistic about the legislation, the Foundations for Evidence-Based Policymaking Act, that we'll see it enacted sometime in the near future. And I encourage all of you to remain active participants in this discussion and encourage ACF, HHS, the rest of government, your states, local governments to increasingly adopt evidence-based policy-making mechanisms, whether it's through data infrastructures or to the question about use. This is ultimately all about improving government policies. I want to thank you all for your attention and the great questions, and encourage you that if you have not yet read the Commission's report, again, we're biased, we love it, but would encourage you to take a look at it for the substance, beyond the details that we were able to cover in the course of the short panel today. You can find it at bipartisanpolicy.org/evidence, and you'll also be able to find a number of the other resources from the Commission. An important note here, the Commission website is about to shut down, so if you go there, it may not be there by the time you get there, so I encourage you to use the BPC website. Again, thank you all, we really appreciate it. And thank you to the panelists.